The Brown Child Psychiatry program is relatively historic. It started in 1960, just after the board certification began for child psychiatry. One of the things that's very unique about the Brown Fellowship is our resources. We have a state-of-the-art hospital at Bradley Hospital that just was renovated in around 2009. We have 65 inpatient beds and a whole spectrum of outpatient services, residential services, and partial services, all of which the residents become involved with. Our Hasbro Children's Hospital is a top-rated pediatric hospital. It has the full service of tertiary care medical facilities, and residents are involved in consultation liaison as well as managing the emergencies over at Hasbro Emergency Room.
Bradley Hospital is essentially the only freestanding child psychiatric hospital in the nation, but furthermore, we are pretty much the only provider for children's mental health services in the state. So we're like the largest hospital in the state that provides care for children, which means that you see kids from different socioeconomic backgrounds, you see kids from different ethnic backgrounds, and you see kids with a variety of diagnoses. So there are no limitations to what you'll see at Bradley in terms of your training, and that was a major thing that attracted me to the program.
This program is incredibly unique and really provides the kind of training I was not going to get anywhere else in the country, and I looked at programs all over the country, and I really felt like this program had incredible resources, faculty that stay on for years and years and who are experts in their fields. I also felt like the depth of training in terms of the different hospitals we visit and the amount of time we get to spend there was really unique.
We have a variety of inpatient units. We have a developmental disorders unit, we have the children's unit, the adolescent unit, then we have the crisis clinic, that's for families that need to be seen sooner but do not meet criteria for an inpatient level of care. And we also have partial programs. We have the PD partial program for small kids. We have the Hasbro partial program for kids with psychiatric illnesses as well as medical illnesses. So when I was looking at the website as well as different material on the program, I said, wow, all of these different things are part of this, fellowship program, and I just knew that it'd be like no other.
Women Infants Hospital has a day hospital in which mothers bring their newborn children, and that actually is unique in the entire country. There's no other program like that. So those kinds of really unique experiences are here at Brown in Rhode Island and very much available to us as trainees.
We have a very diverse group of faculty with many interested in research, both basic and clinical. We have many who are running excellent programs. All of them are very involved in the teaching fellowship and are excellent in terms of what they do.
Bradley Hospital and Brown University are great places to be a research faculty, mainly because there really is a great interplay between clinical services as well as researchers of varying backgrounds, really making for far greater depth of understanding of research and greater, appreciation for the research that ultimately is going to help kids in the future.
Everybody here is just so supportive. Really, really interested in our interests and our professional development, and it's just really very much so heartwarming just to be around such great people who are so friendly. It's not a matter of just friendly on interview day, but friendly every day. The doors are always open. My clinical supervisors have just really, really, supported me throughout everything. It's not easy to work with children and families, and just to know that you have supervisors that have you back is just really, like no other.
So it's a very enjoyable and fun job that I have and my faculty colleagues have working with residents who come here. We have a very family-oriented program, and when people graduate, they remain part of the Brown Child Psychiatry family, and we have at annual meetings, have gatherings, and people get together just like your long-lost family members. And it's really a nice kind of warm feeling, and I think that's something that is probably not everywhere, but at Brown it really is a real strong feature.